Welcome to the We Level Up Treatment Center video series. In today's video, we will discuss: can you drink alcohol while breastfeeding? Breastfeeding is a vital bonding experience between a mother and her baby, providing essential nutrients and antibodies. However, whether alcohol consumption can be balanced with breastfeeding often arises. Many new mothers wonder about the safety of having an occasional drink while nursing. Let's delve into the topic and explore the potential risks and guidelines for alcohol consumption during breastfeeding. How is breast milk produced? Breast milk is produced by mammary glands found in the breast tissue. These mammary glands are present from birth, but become fully useful for milk production only during pregnancy. Several hormones regulate the mammary glands' development and lactation initiation and maintenance. The most significant of these hormones are oxytocin and prolactin, both produced in the pituitary gland in the brain. Prolactin, together with other hormones, estrogen and progesterone, regulates the final development of the mammary glands during pregnancy. After birth, the woman's hormonal situation changes, and in this setting, prolactin can start milk secretion from the mammary glands. How much alcohol can you drink while breastfeeding? The amount of alcohol a breastfeeding mother can consume while still providing safe milk for her baby is a subject of careful consideration. It's generally recommended that if a mother chooses to drink alcohol, she should do so in moderation. One approach is to wait at least 2-3 hours per drink before breastfeeding. This allows time for alcohol to clear from the bloodstream and milk. How long does alcohol stay in breast milk? Alcohol can stay in breast milk for several hours after a person drinks. Generally, the amount of alcohol in breast milk will peak around 30 to 60 minutes after the drink is consumed and gradually decrease over time. The length of time alcohol stays in breast milk can depend on various factors, such as the person's weight, how much alcohol they consumed, and how quickly their body processes alcohol. If you're concerned about drinking alcohol while breastfeeding, consulting a healthcare professional for advice and guidance is always best. How long does alcohol stay in the breast milk chart? While the amount of time that alcohol stays in breast milk can vary depending on individual factors, such as weight, age, metabolism, and the amount and type of alcohol consumed, here is a general timeline of how long alcohol takes to leave breast milk. For a standard drink, i.e. 12 ounces of beer, 5 ounces of wine, or 1.5 ounces of hard liquor, it typically takes 2 or 3 hours for the alcohol to clear from a mother's breast milk. If a mother drinks heavily or consumes more than one drink, it can take longer for the alcohol to clear from her system and breast milk, up to 13 hours or more. The rate at which alcohol is metabolized can vary depending on individual factors, so these estimates should be taken as general guidelines rather than strict rules. If you're concerned about the effects of alcohol on your breast milk and breastfeeding, it's best to consult with a healthcare professional for personalized advice and guidance. They can provide you with more detailed information about how alcohol affects your body and breast milk specifically, and help you make informed decisions to keep both you and your baby safe and healthy. When you breastfeed your baby, alcohol might enter your milk and your child. Alcohol and breastfeeding, how long to wait? Drinking occasionally won't likely hurt your child, especially if you wait at least 2 hours before feeding them. Regularly exceeding the advised limits might be dangerous to you and your child. In addition to the well-known health hazards associated with excessive alcohol consumption, drinking too much can reduce your milk production. Your baby can experience issues with sleep, development, and growth. Things to know before breastfeeding: as the urban myth suggests, drinking beer does not increase the lactating mother's milk supply. Drinking alcohol of any kind may decrease the breast milk the baby drinks. Drinking alcohol and breastfeeding can change the taste of breast milk, and some infants may not like it. Drinking alcohol and breastfeeding an infant can pose a risk to the baby if he or she consumes breast milk with alcohol. Pumping or expressing milk after drinking alcohol and then discarding it, pumping and dumping, does not reduce the alcohol in the milk quicker. As the alcohol blood level falls over time, the level of alcohol in the breast milk will also decrease. Breast milk continues to contain alcohol if alcohol is still in the bloodstream. Current research says that occasional use of alcohol, 1 or 2 drinks does not appear to harm the nursing baby. Many experts recommend against drinking more than 1-2 drinks per week. Excess levels of alcohol in milk may lead to drowsiness, deep sleep, weakness, and decreased growth in the infant. Reduction of letdowns is reported when the mother drinks heavily. Drinking alcohol and breastfeeding may reduce the baby's sucking time at the breast, but not the volume of milk consumed. Never share a bed or other sleeping surface with your baby if you have been drinking alcohol and breastfeeding. Drinking affects your natural reflexes, and drinking and bed sharing are more associated with sudden infant death syndrome, SIDS, alcohol, breastfeeding side effects. Of course, not drinking alcohol is the safest way for breastfeeding mothers. Typically, moderate alcohol consumption by a breastfeeding mother, up to 1 standard drink per day, is not known to be harmful to the baby, especially if the mother waits at least 2 hours after a single drink before breastfeeding. However, drinking alcohol above moderate levels through breast milk could damage a baby's growth, development, and sleep patterns. Alcohol consumption above average levels may also undermine a mother's judgment and ability to care for her child safely. Sleep disturbances, increased arousal, increased crying, increased startling, increased rapid eye movement, REM, sleep from 3.5 to 24 hours after alcohol exposure, decreased weight gain, decreased milk intake by the baby, growth retardation, impaired immune function, delay of motor development, potential impairment of cognitive development, reduction in the ability for abstract reasoning at school age, 6-7 years. Pump and dump breastfeeding alcohol. You may have heard of women pumping and dumping, or pumping and throwing away their breast milk to remove the alcohol fast. The truth about alcohol and breastfeeding is that alcohol exits your bloodstream and breast milk at the same time. Pumping and dumping will not eliminate alcohol because it is not contained in breast milk and returns to the bloodstream when your blood alcohol level decreases. Pumping and dumping, consuming lots of water, taking a nap, or consuming coffee will not hasten the pace at which alcohol is eliminated from your body. Alcohol is not removed from breast milk more quickly due to this procedure. Instead, when the mother needs to express her milk so she doesn't use it to feed, it may be used to eliminate alcohol-filled milk. Ask your doctor or lactation consultant if you have questions about breastfeeding and alcohol. Helping yourself or a loved one should be achieved without sacrificing comfort and safety. We Level Up NJ provides a safe and comfortable inpatient alcohol rehab program with licensed therapists and 24-hour health monitoring. Call us now. We have a 24/7 hotline that is ready to assist you. That's it for today. Please subscribe and hit the notification bell. Like, share, and comment. We would love your feedback. Have a great day.